Good morning, everybody. I'm Ed Abrahams, president of the Personalized Medicine Coalition. And it's my pleasure to welcome you this morning and to introduce today's conference. Although we no longer talk about a war on cancer, there's one part of the metaphor that I think remains useful. In a military campaign, we employ multiple weapons, and so too in our effort to turn the tide against cancer, or the over 200 identifiable forms of that disease that will kill over 600,000 Americans this year. We need to employ all of the resources at our disposal, just as we would if we were in a war. As we will hear at today's conference, turning the tide against cancer through sustained medical innovation, promising new insights into the molecular pathways of cancer offer new hope for progress in research and clinical care. This trend was documented in AACR's Cancer Progress Report issued last year. And if you haven't read this document, I strongly encourage you to look at it. It will inform our discussions today. As AACR's CEO, Marge Ph.D., noted, the report highlights the astounding return on investment in cancer research and biomedical sciences supported by NCI and NIH. But how we define the space between the promising research and the bedside is also going to be critical to ensure the continued progress that we as a nation expect from our investments, public and private, to address this illness. We at the Personalized Medicine Coalition contend that it is crucial to maintain, if not increase, public and private budgets for research to advance the science upon which this progress depends. But equally important, we also believe, is how we conduct clinical trials, how we approve targeted drugs and companion diagnostics, what kind of reimbursement policies we put in place, and how we educate providers so that they don't wait 17 years before adopting new methods, tools, and therapies. These systems, regulation, reimbursement, and education will determine the rate of progress in turning the tide against cancer, and moreover, also help us get a handle on exploding systemic healthcare costs. Today, we will explore where are we at the present, how can we maximize the return on our considerable investments in cancer research and clinical care, and how we define value so that we can contain, if not cut, systemic costs while improving health. These questions will shape our discussions today. We are very fortunate to have had some of the world's leaders in the cancer community, including Dr. John Mendelsohn, whom I will introduce in a minute, to help us prepare this conference. The names of the advisory committee are listed in your program. On behalf of AACR, Feinstein Keen Healthcare, and PMC, I want to thank them for their counsel and insight. As you know, like most museums in Washington, this conference is free, but that's not because the cost was zero. In addition to PMC's members, I want to thank a number of institutions that have sponsored this conference and our ongoing educational and advocacy efforts. They include First Pharma, which has underwritten our luncheon, and includes also the pharmaceutical companies Novartis, Pfizer, and Eli Lilly, diagnostic companies Assuragen, Clarient, and Foundation Medicine, and the cancer advocacy organizations American Cancer Society, Cancer Action Network, ASCO, the Association of American Cancer Institutes, and the Ovarian Cancer National Alliance. Please join me in thanking them for their financial support, without which we would not be able to have this conference. I would also like to thank Marcia Keene, Chairman of Strategic Initiatives at Feinstein Keene Healthcare, who helped prepare the important pre-conference discussion paper. And if you haven't read it in advance, please read it afterwards. There will be a quiz, and we also hope to follow up on it. I'd also like to thank Jen Kazenza, Carrie Littman, and Aaron Slattery, also of Feinstein Keene, who have done the hard work of putting this conference together. And because we don't want you to leave Washington without at least a glass of wine, I also want to invite everyone to stay for the reception that will immediately follow this conference in the same room as we have lunch.